Hello everyone and welcome back to the Mental Wellbeing Show. Today's episode is on all things growth mindset in mental health with Professor Jeni Burnette. Jeni is a professor of psychology at the North Carolina State University, and Jeni's research focuses on how to implement growth mindsets in individuals and organizations. Jeni directs the Mindset Lab, and her work has been featured in a number of media outlets, including the New York Times and Huffington Post. In today's discussion, we dive into the differences between a growth mindset and a fixed mindset, how you can increase your growth mindset, how your mindset for anxiety can change your experience of anxiety, and much, much more. Today's episode is audio only, so sit back with your cup of tea, glass of wine, or whatever tickles your taste buds and enjoy. And as always, if it does bring you value, I would be so grateful if you were to hit subscribe and follow. Episodes with global wellbeing experts are dropping weekly on Wednesdays on the Mental Wellbeing Show. Now to today's episode with Professor Jeni Burnette on all things growth mindsets in mental health. Welcome to the Mental Wellbeing Show, where we take a deep dive into the wonderful worlds of psychology and mental wellbeing. Each episode, we dive into the evidence with a global subject expert and break down the science into applicable strategies so you can take steps to improving your mental well-being. Dr. Jeni Burnette, welcome to the Mental Wellbeing Show.
Thank you.
It's great to have you on. This has been a conversation that I've been looking forward to for some time now. It's been a few months in the making, so highly anticipated conversation for myself to be able to speak to you about all things growth mindsets. I think we can start, Jeni, by just defining what growth mindsets are. I think it's a term a lot of people will have heard of, but looking at it from a research point of view, what are growth mindsets?
Sure. Yeah. Thanks for having me. I'm excited to be here today to share with you some of the information and research that I do on mindset. Yeah. So growth mindsets in kind of the simplest form are beliefs about the malleable nature of attributes, traits, emotions, and abilities. People with a growth mindset believe those things can change, they can be developed through hard work and the right strategies, where individuals with a fixed mindset believe more strongly that these things are more innate. They believe more in talent, for example. They think that effort is an indication that you lack the innate ability. The main kind of difference between the fixed and growth mindset is that belief in the fixed versus malleable nature of different attributes and characteristics.
And as I understand it, it's kind of on a bit of a dimension, right? It's not that we either do or don't believe things are entirely changeable, but they kind of just vary to a certain degree, like on a continuum.
Yeah, that's a really important distinction that we make. You're not either or. Another couple of distinctions I like to make when kind of defining the theoretical landscape of mindsets is that you can either have kind of what's called a deliberate mindset or dispositional mindset. So many of us might have kind of an inclination across time and situations to believe, for example, that intelligence can change, but we can also be shifted by experiences and interventions and experimental studies to believe kind of more or less strongly one way or the other as fixed or growth. Another important thing to keep in mind is that these are really ability specific. And I can give you kind of an anecdote and example of what I mean by this. So for example, I grew up playing a lot of tennis and I wasn't super strong or fit. And I worked with an athletic trainer and developed my ability to kind of become fitter. And I developed a growth mindset of fitness. But at the same time, my parents decided I should take a piano lesson. And I kid you not, the piano teacher told my parents it was a total waste of time. Like I would never learn how to play the piano. I developed a very fixed mindset of music ability, right? And so, I might believe I can become fitter and stronger and I'm very athletic, or I can change my athleticism. But I might then at the same time believe very strongly that my music ability is something that's kind of fixed and can't be developed.
Yeah, wow, okay. That's so important to note as well, right, that we have these different kind of mindsets towards different domains, because looking through your research and a lot on the growth mindset literature, this kind of applies to some of those different domains: intelligence, athletic ability, weight, and mental health as well. Particularly with a mental health lens, Jeni, what does a growth mindset towards mental health kind of look like?
The answer is more complicated than maybe, say, intelligence or different types of ability. For example, some of the mindsets of anxiety are really like, I can change my anxiety or I can't. But what we're looking at more and more is more about the mindset or belief about the experience of anxiety. So is the experience of anxiety something that's more enhancing or more debilitating? What does it mean to feel anxious? Is it say something about the kind of person I am? So we're trying to kind of look at a more complex mindset when we think of mental health. And we're doing this specifically in the domain of anxiety. There's the malleability aspect, but there's also the experience aspect, is what does it mean to experience it? And then also there's kind of the kind of person. Am I just an anxious person and I can't change the kind of person I am? My anxiety is just fixed and I can't change it. And my anxiety means to me that it's a signal to try something new, or it means that like I'm debilitated and I can't do anything, right? So there's kind of three aspects that we're trying to look at when we think of these. And this is some of the newer research. So we don't have quite much empirical data yet, but I do think that it's a complicated answer as to what's a mindset of mental health or anxiety. I think there's multiple components because it's just different than an ability. And I think similar to what I said about kind of tennis versus or kind of fitness versus athletic ability and music ability, we find differences in STEM fields like computer science and math don't even really correlate that strongly. Mindset's about the two kind of STEM. I just wonder how much we also have really distinct mindsets within mental health. Like, for example, addiction, anorexia, anxiety are all very different. And so maybe people have really distinct mindsets within those.
Do you think that people bring mindsets to their experience, kind of prior mindsets about mental health, or it's pretty much shaped by the experiences that they have, that if someone has, for example, anxiety and hasn't been able to change it, they may come with a belief that's, a bit more of a growth mindset. I can change this, but after their experience, feel like it is less malleable based on their experience of not being able to change their anxiety themselves? I
think so. I think that's a question that we're also really interested in. Like, what are the etiologies of these mindsets, right? We know Carol's done some work in intelligence that like praising effort versus talent and aptitude influences these, but we really don't have a ton of information on the etiology of mindsets of mental health. I do think part of it is experiences. For example, we have one paper with self-regulation. Kids who have, or adults who have ADHD have stronger fixed mindsets. Right? Like their experience is that they constantly try and self-regulate and they don't always do it, can't kind of improve their ability easily. And so it does seem like there is some component to the etiology of these that is the experience, right? If I experience a lot of anxiety and nothing I'm doing is helping, then I develop more of a fixed mindset, which is why I think it's important in mental health not to focus just on the changeability of the feeling itself and more about the meaning assigned to it, right? It might be that I can't really change how anxious I feel in the situation, but I can change the strategies I use to cope with the feeling and what that feeling means to me.
I think you alluded to it earlier as well. You mentioned the word debilitating, and I came across some of the literature on anxiety mindsets about anxiety is facilitating and helpful versus anxiety is debilitating. So the idea that, in some situations, a bit of anxiety can help you. It makes you more alert. If your heart rate's increased because of the anxiety you're feeling, that's good in a physical sense if you're about to, play a soccer match. So the interpretation of your symptoms can influence your actual experience.
Yeah, exactly. And I think that's an area in which it's a little easier to kind of intervene and change the meaning assigned to the experience than it is to change the emotion itself, right? The idea that you need to even change it in the first place. So feeling anxious is not necessarily a bad thing. It means you care. It means it's important to you. Like you said, it's your body physiologically preparing for, something that's important. Maybe it's soccer. Maybe it's giving a speech. It signals two things. It signals that you care and it signals that you need to prepare, right? And both of those things are actually pretty good things. I mean, anxiety is an incredible motivator, right? I mean, we feel anxious about something upcoming and therefore we prepare for it. And so in some ways, it's changing the narrative around the meaning of anxiety that's as important as it is to change kind of the belief about whether anxiety itself can change or not. So I think in mental health, it's just way more complicated. Even in weight, an area I study quite a bit, it's just a lot more complicated than something like intelligence or athletic ability. Like the abilities aren't really experiences, whereas the emotions and the mental health and that sort of thing, I think there's multiple components to it.
It must be difficult, though, to be able to change your mindset towards anxiety, because I just feel like the message in broader society is that if you feel any sort of anxiety or stress, that it's, this is a negative thing, it is debilitating, or, the stress is not enhancing, it's harmful, and that we should avoid it as much as possible. So a very kind of, I suppose, different kind of mindset to take compared to what the norm is in society and what we're trained to believe about anxiety and stress.
Yeah, I agree. The narrative is definitely not what we're trying to send necessarily as enhancing, right? And I think that's another way in which the etiology of these, right? Like the culture and the narrative and what we're being told about what we should assign, what meaning we should assign to the experience is very influential. There are a number of new books talking about kind of leaning into anxiety and coaching parents to let their children experience anxiety, and that we know like bulldozing parenting, which is, removing all obstacles that cause anxiety, is not the right approach. It sends that debilitating message, right? It sends a message that kids shouldn't feel anxious. They can't handle the anxiety's bad. So let's remove the barrier. And instead, I think there is more and more coaching and parenting and teaching manuals and books encouraging kids, especially young and early, develop the skill to handle the anxiety, like sending the message that anxiety is okay. Feeling anxious, that's okay. Lean into it. What does that mean? How can we help, right? As opposed to being like, oh, you feel anxious? Let's, see if we can get the teacher to extend the deadline. Or, oh, you feel anxious? Let's change the way that the assignment is given to you, right? It's like, instead of changing the situation to reduce the anxiety, we change the narrative and say, it's okay. You can actually handle stressors. Like, you're really resilient. Here's, what the anxiety could mean. So I agree with you. It's a hard narrative to change, but I do think it's one that people are recognizing the value and potentially changing it.
And you alluded to something there as well, Jeni, in terms of kind of the way that people, in particular children in that example, kind of internalize the message about anxieties. Typically speaking, from like a fixed and growth mindset point of view, what are the differences in how someone may appraise an anxiety-provoking threat or even their symptoms about anxiety? What does that kind of internal cognitive process look like?
Yeah, so I think, signs of a kid with a growth mindset include, they embrace the challenges. So they're more likely to take on novel and more difficult tasks with enthusiasm. I think they view setbacks as opportunities to learn. So they're more willing to experiment, iterate, receive constructive feedback. They think of it as constructive feedback as opposed to thinking of it as just purely criticism. So even the meaning of the feedback changes. So kids with a growth mindset see feedback as, oh, you care about me and you want me to learn, versus kids with a fixed mindset see feedback as a direct criticism of their self-worth, right? For example, when kids get, feedback from their coaches, some kids say, oh, that coach doesn't like me, and that coach thinks I'm a terrible person. And that's one narrative. That's one way to interpret it. That kid's kind of having a fixed mindset. If you want that child to have more of a growth mindset, you can change their own story around what that coach means. Actually, that coach is taking time to offer you feedback. They see that you have potential, right? They see that you have an opportunity to develop, and that's why they're providing the feedback. Feedback is an opportunity to learn, viewing feedback as an opportunity to improve. Individuals with growth mindsets also often actively seek feedback. They want to improve their skills and performance, and they're often seeking out ways to do so. They're more inspired by other people, find inspiration in the success of others, and see it as evidence that they too can achieve something like that they can aspire to that. Whereas individuals or kids with fixed mindset, they look to successful others and feel intimidated and feel like they're threatened. Fixed mindsets avoid challenges. They resist feedback. They tend to be jealous of others' success. A lot of times, one of the fundamental questions, I think, to understanding if a kid has more of a fixed or growth mindset, or the differences between these, or how are they interpreting challenges in their life? Are they leaning into them and learning and seeking help, especially from successful others?
It feels like a lot of it comes down to their identity as well, right? In the sense that if you have a strong sense of who you are, but understand that can change and evolve, then you're more likely to be receptive to that feedback, versus if you have a more, I suppose, insecure about who you are, and you're more likely to internalize any feedback as kind of a stable, kind of a one-off attribution as to who you are globally and who you'll be forever.
Yeah, and I think that relates a lot to when these mindsets matter most, which is when we feel the self is threatened, right? I think kind of what you're getting at is when we have this threat to self-esteem or self-worth, whether that be a setback, a challenge, a domain we really care about that we're not successful in, right? I mean, this stuff matters a lot less if kids don't even care. Like, if they don't care if they're a good athlete, then it doesn't really matter, right? I think the identity part's important, and that we need to be invested for mindsets to matter, and also we need to be challenged.
Hello everyone, just a quick break from today's episode to let you know that episodes of the Mental Wellbeing Show are dropping weekly. I also release short digestible clips on psychology and mental well-being on our YouTube Shorts and Instagram pages Monday to Friday. If you'd like to stay tuned for these, make sure to hit subscribe and follow. Now back to today's episode of the Mental Wellbeing Show.
They don't really, kids, who are really successful in a particular context, their mindsets aren't going to predict outcomes nearly as strongly.
And in terms of having some of these growth mindsets, Jeni, what are some of the benefits of having a growth mindset as opposed to a fixed mindset?
Sure. I'll focus kind of on the mental health since that's where we've been talking. Some of them overlap, for example, motivation and self-regulation across kind of context. Students and adults and people with growth mindsets tend to set learning goals. They respond to setbacks with optimism. They cope more effectively. They use mastery-oriented rather than helpless-oriented strategies. That's kind of across context. In terms of mental health, individuals with growth mindsets tend to report less psychological distress. They tend to report greater well-being, more life satisfaction. And they do so in part because a lot of times, one of the key mechanisms is what's called threat appraisals. They see themselves as capable of handling stressors. They have the resources, whether that's, and that's a lot of times like internal psychological resources, really not so much like financial resources. So they believe that they have the capacity to handle the stressor. And because they have that kind of fundamental belief system, they use strategies that then help them reduce the distress. Like they're more, for example, more likely to seek therapy. And we know therapy is very effective. The fact that they're willing to seek help really helps them kind of manage their mental health concerns better.
That threat appraisal of I can work through this, recognizing that it's a difficult challenge, but having the confidence that you can actually work through it.
Yeah, and that's an important point, right? These mindsets don't necessarily predict differences in how challenging the situation is. It's not that people with growth mindsets just don't face challenges. For example, there's an interesting neuroscience study that was done, and they gave kids feedback, and the affective they gave them negative feedback, failure feedback. The affective reaction for both kids was fairly similar in the sense that like getting negative feedback immediately doesn't feel good, right? But kids with growth mindsets had a lot more activity in the brain for paying attention and learning in the next step. So then they gave them the feedback, and then they provided some opportunity to learn about where they went wrong. And students with growth mindsets immediately switched from emotion regulation to learning, whereas the kids with fixed mindsets stayed constantly in that emotion regulation. So they felt bad. They just were looking for ways to not feel bad. Does that make sense? So whereas those with the growth mindset, so it's interesting. It's not that they experience the world in a completely different way, and people with growth mindsets just don't feel bad. They just handle it in a very different way.
And this relates to some really interesting work that I saw that you've done in terms of how people actually cope with anxiety with a fixed mindset, like some of the concrete behaviors. And I think procrastination and distraction, what you're alluding to there, self-harm and substance use was higher in those with a fixed mindset when they experienced anxiety, as opposed to working through the problem using things like cognitive reappraisal. So looking at an event through a different and perhaps more adaptive or helpful lens. So I thought that was really interesting to see some of the actual concrete behaviors that people will adopt and how they differ depending on the mindset they take towards that same threat or anxiety provoking event.
That's a really interesting piece of work in the part kind of where people with a fixed mindset are more likely to engage in substance abuse, for example. Reminds me a bit of Carol Dweck's really early work, where kids with a fixed mindset who failed a test and asked what they would do next, they said cheat, right? Because it was like, well, I'm not going to learn it, so why wouldn't I just cheat? Whereas, students with a growth mindset, I'm going to seek help from others, right? So if I believe that I can't manage my anxiety at all and it's never going to change and I'm always going to feel like this forever, in some ways it's like, okay, well, what can I turn to? We found something similar with addiction. Individuals with more growth mindsets of addiction thought that different types of therapies would be more helpful, whereas individuals with fixed mindsets thought pharmaceutical help would be more useful. They find similar stuff in weight, right? Like to manage my weight, turn to behavior change, or do I turn to to drugs to help, or to surgery, or not drugs as much as medication and surgery. And what we find is the choice really depends on what I believe about the nature of the condition.
And in terms of the nature of the condition, this really brings to mind, I suppose, the etiology of different conditions, of whether it's weight or obesity and also mental health. And I feel like if you take more of a biological lens to the causes of your depression, of your obesity, then you perhaps are less likely to engage in some of the lifestyle changes compared to, say, a more medication approach. And again, obviously, both obesity and mental health, there's a myriad of causes that can lead to these kind of conditions, including biological causes. But perhaps that lens that you take to why the condition you have is what it is will affect the behaviors you engage in and the mindset you take overall to your condition.
Yeah, for sure. And I think you bring up a couple important things to keep in mind when we're talking about mental health and weight, that there are a myriad of contributors and reasons that people struggle with these. And often medication is a very useful useful and necessary approach in conjunction with therapy and other things, right? And I by no means think a growth mindset can cure all or address all the complexities of these issues. But yeah, I think the lens and the narrative that's told really influences these beliefs and behaviors. And a lot of the work we do looks at disease messaging. In fact, we use articles that we find in the news describing obesity as a disease or describing mental health as a disease. And we know that these disease messages are complicated, nuanced implications for mindsets and subsequent behaviors. And so they do make people have stronger fixed mindsets, which in some ways is good because it reduces blame, which reduces stigma. The kind of cost of the disease message is that in reducing the growth mindset, they also increase what's called social essentialist thinking, which is the idea that there's an underlying essence of people, that knowing someone's overweight tells you something fundamental about who they are. And in stigmatized contexts, that increases stigma, and you also get the costs of disease messages of sometimes undermining motivation and self-regulation. In some of these domains, we've worked to develop what we call a compensatory message. It's a growth mindset message that tries to reduce the blame. So we try and keep the growth, but also recognize that complicated and that there's a number of causes and the person isn't necessary to blame, and that we need really, these messages also are what we call context conscious. They really highlight the importance of seeking help from others and not doing it alone, from changing the environment and finding a supportive environment and building a culture that supports the opportunity to make the changes. That it's not just this individual should, pick it up by the bootstraps. That's not what we're saying. In fact, Carol has quite a bit now on false growth mindsets, which are that. It's the idea that a growth mindset is just put in more effort. And it's not that. And especially in mental health and weight, that we need support and we need environmental changes and we need to make changes at a number of levels before we can kind of see the actual change in weight or see an improvement in our mental health. And so we've been sending kind of what we call these compensatory growth messages that try to keep the benefits without the costs.
That's a really important point about those limitations of the growth mindset. I think, to be honest, when I first came across your work and Carol Dweck's work, it would have been years and years and years ago, that was the message that I internalized. The perception that I saw it through was, okay, I just need to try harder and take a different mindset and everything will change. But obviously there are the limitations to it. Do you have examples of how some specific kind of environmental limitations do preclude people from changing their outcomes even when they adopt a more growth-oriented mindset, whether it's in schools or, in mental health?
Yeah, David Yeager has some really good work on what he calls contextual affordances, which is a complicated term for basically students in schools that have the students have the opportunity to grow and learn. They're in an environment that supports growth kind of over performance. Those students benefit more from a growth mindset than students, for example, who are in low resource schools, don't have opportunities to improve, and are perhaps in a really structured performance environment that only stresses how to get an A. Similarly, in organizations that have more of a growth culture foster greater curiosity in their employees. They're more willing to take risks. They are more engaged at work, right? So to the degree that the culture is growth oriented, then the individual's growth mindset can really contribute to the outcomes. Because if the culture and the individual mismatch, it's hard for the person to really truly have the opportunity to show their growth in ways that correspond with growth, not just with performance. So if you stress performance too much, it's kind of hard to have a growth mindset, because a growth mindset might be that I'm willing to take on a challenge and I'm willing to, try something entirely new, and it might be risky and super innovative, and I'm curious, but it fails, right? So my performance doesn't improve, but I'm only going to be willing to take those risks and be innovative again if I'm not told that that's a failure. I'm told, right, the meaning of that is that I was curious and innovative and sought to learn, and that's what this company is about, or that's what this classroom's about. But if I take all those risks and then I'm told, like, I'm passed over for a promotion because I failed, then I'm unlikely to do that again.
Yeah, the reward, the outcomes that you reward and incentivize for, I think, really send the message as to whether it's a growth or fixed mindset environment, right? Whether it is very outcome-driven, performance-oriented.
Yeah, Elizabeth Canning has some really interesting research even on kind of how syllabi can signal whether the teacher has a growth mindset or fixed mindset. Even saying, I have office hours because I think everyone should stop by. I really, value the opportunity to help you learn versus I have office hours, right? Or, why I give feedback on exams and what that feedback means. And so there's even some work that syllabi can signal whether the professor believes you can learn or not.
Cool. No, really interesting to see how those different environments do set up for whether a growth or fixed mindset is adopted by those within the environment. And I suppose one of the real big questions as well that I had, Jeni, coming in to today, and I'm sure that many people too listening, is if, we recognize that we have more of a fixed mindset and we're wanting to change that, how can we go about facilitating that change, moving up the dimension or continuum from a fixed mindset to a growth mindset?
Yeah, that's where most of my research is these days, is kind of in interventions and implementing them well and powerfully. So basically, how can I most strongly foster a growth mindset? And I think it's important to recognize that what we did very early on in our conversation is that these are a continuum. So some days I might be more fixed, some days I might be more growth, right? And it's okay to recognize and be that, right? I think we need to have some self-compassion when we see ourselves in a fixed mindset. Many of the things we do to kind of foster a stronger growth mindset is to remind people to focus on the process and that it takes time and effort even to develop the growth mindset. Be patient with yourself. Focus on the journey of learning and self-improvement. Instead of focusing just on the destination or performance, for example, really set goals that are focused on learning. So that's one of the main steps. We also include learning about the benefits of growth mindset. So people listening, right? Learning the benefits of a growth mindset, and that can motivate them more to adopt the growth mindset. We find knowledge to be an important step. We also, tell people to remind themselves that they can make a change and that they can really, stop. And it's kind of what you said about the cognitive reappraisal, right? Take a step back and view, for example, a negative experience or a negative emotion as a chance to learn instead of an indication of your self-worth. So when you feel yourself in a fixed mindset, you can kind of change. One activity we do, for example, with our kids is we have them name their fixed mindset and say, for example, my younger kid named it, I don't know why, but blueberry muffin. For example, when you hear kids name things, but yeah, adults may name it something different. But like we said, when you hear blueberry muffin, what does it sound like? Like, what does your fixed mindset voice sound like? So recognizing what it is and what it sounds like. And he said, well, I tell myself I can't do it. This particular incident related to online schooling and math. And he said, well, I really feel like I can't do it all. And we said, well, why do you feel that way? And he's like, well, when you hand it to me all at once, it's just too overwhelming. And I think I can't do math. And I said, okay, well, when you hear that voice, what could you do differently? And he said, well, I could ask you to hand me only 3 problems at a time, and then I might not feel overwhelmed. Part of it is just finding the voice. What does my fixed mindset voice sound like? When I hear that voice, what can I do differently? How can I be more mastery oriented instead of avoidant? And so those are some of the many kind of activities that we do and ways that we try and get people to continuously develop that growth mindset.
Yeah, I love that. And I love it seems to relate a lot to one of the core themes that I've seen in some of the interventions that you've written about in your work, about kind of envisioning how you'll use a growth mindset the next time you face a threat in your life or a challenge in your life. And I think you get people to actually do that as an exercise in the intervention, which I think is something that people can readily use and take away from today's conversation.
Yeah, for sure. I think, right, like practicing forecasting, if I experience a setback, then I'm going to remind myself I can change. I'm going to think about ways to be mastery oriented and to approach this and seek help from others, right? I think all of those strategies are really helpful.
As well, if I just reflect on my own journey, one of the things that really helps me when I'm catching myself in a fixed mindset. For example, I was giving a speech the other day, and I, like many people, do not like public speaking. Certainly doesn't come naturally to me. And I felt like I was being grilled by the evaluator, and certainly some of the self-talk afterwards was reminiscent of a fixed mindset. But what really helped was just drawing to mind kind of this proof of concept, all the other times that I have grown from stress and from challenges, and, calling to mind the other times that I've had to face such threats, but learned and come out the other side, so to speak, from it. And I don't know if that's something that you've used, in your research, kind of drawing upon these past experiences, but certainly that proof of concept from past challenges really helps me to kind of move from the fixed mindset to growth mindset.
Yeah, absolutely. I'm glad you brought up that example. It's what we do in interventions. We call it saying is believing. We have them write about a time that a growth mindset helped them. I mean, that's literally, I think exactly kind of the example you gave. When did, thinking that you could change and learn and you faced a setback, and how did you learn from it? Yeah, we definitely have people reflect on that in our interventions. And in one of the papers we wrote, one of the implementation papers, we talk about that as like a really critical ingredient of growth mindset interventions, is that saying is believing component.
Saying is believing. Okay. Love that. I'll have a look into that, because I didn't know that you'd actually included that in one of in your interventions. So that's fantastic to see. Is there anything, I suppose, that you wanted to add just finally, any kind of pieces of advice you wanted to give to students and listeners tuning in today, Jeni?
It's funny. I should anticipate this question. I often get it. I think part of it is just, remembering that even the development of the growth mindset is also a process, right? Like it takes effort, and the meaning assigned to that effort isn't that like, oh, I'm never going to get a growth mindset. The effort and the hard work is part of the process. And similarly, developing a growth mindset, you can seek support from others, successful others. I think, one of the ways that we encourage growth mindsets as well is showing examples of people who have growth mindsets who've been really successful. I think remembering many of the processes that make someone growth oriented are also the processes you need to go through to develop your own growth mindset.
Fantastic. And I think that certainly relates to your note that you made earlier about self-compassion and understanding that it is a fluctuating process. And that's certainly something that I'll take on board, Jeni. So thank you for sharing that and for all the wisdom that you have shared today. This is really cool and applied conversation. And I'm sure many students will walk away with plenty of cool, applicable tips that they can implement straight away in their life.
Well, yeah, thank you so much for inviting me and for being so prepared to talk about the work. And I really enjoyed the conversation.